have memories of moments we wish we could forget, ones that flood us with negative emotions such as guilt, anxiety, resentment, hatred, sadness. For others, these moments were a matter of life or death, having them stuck in a loop. Memories that could have been made easier to endure or put to rest if there was some sort of intervention, a cry for help that never took place. What would cause one to go seeking help? It could be a matter of naivety or ignorance. Other times, it could simply be the unwillingness to put in the effort to seek aid, maybe because of the costs to be incurred, time management, or just plain laziness. Regions having majority of their population living in absolute poverty are often littered with cases of bribery, corruption, and extortion, resulting in people losing faith in systems meant to help them. We often find that most of those seeking justice rush to social media or national broadcasters instead of the establishments put in place to tackle their grievances. This is in the hopes that one more influential might extract the intended results, which seems to be the case with Zambia, where our national broadcasting television is usually bombarded with cases that could otherwise be sorted out without the need to be televised. Part 1 of this piece ended on the note, where can one report abuse by a health practitioner? First of all, we need to understand that there's a difference between a healthcare practitioner or provider and a healthcare worker. A healthcare practitioner or provider is anyone with the authority to practice medicine or surgery and can provide healthcare services to patients, while a healthcare worker is anyone working in a healthcare facility and has direct contact with patients. For example, those who provide secretarial, chaplain, cleaning, security, and food delivery services. All health providers would also be healthcare workers, but not all healthcare workers are healthcare providers. Moving on, have you ever heard of Health Professions Council of Zambia, General Nursing Council of Zambia, Nursing and Midwifery Council of Zambia, or even know their functions? If not, you can't really be blamed for your utter ignorance about them, can you? I mean, you haven't been in a situation that requires their services, so what's the point of inquiring about them, right? If you just agree to that statement, then I'm sorry to say that that is one more problem for humanity. The influx of reports on abuse by health workers and health practitioners should be able to trigger concern enough to encourage one's participation in seeking and finding solutions. It is said there are two sides to a story. Maybe the said entities are to be blamed. Are efforts being made to sensitize the populace? Is information dissemination as intense as advocating for vaccinations or build changes anthems? As you might have guessed by now, the institutions mentioned are places where one can lodge a complaint, where one can seek help. It is important to understand that the legislature has defined only certain events as violations, and each establishment can only handle cases that fall within their jurisdiction. For instance, Health Profession Council of Zambia, a statutory regulatory body established under the Health Professions Act No. 24 of 2009 of the Laws of Zambia, and formerly known as the Medical Council of Zambia. Despite its spearheading the provision of health services and having the mandate to register and regulate all health facilities, both public and private, including training institutions teaching health sciences, it cannot register a nurse or a midwife, nor regulate their professional conducts, as they are registered and regulated under a different act. iHeartInfo visited the institution's website www.hpcz.org.zm a couple of times with the intention of gathering information on how to launch in a complaint. Two options were presented, the first being complaint procedure. Not sure if it was the browser iHeartInfo was using or HPCZ's website that was faulty, but a document presented under this option titled Complaint Procedure Manual could not be accessed. The second option had 9 committees of the council listed, of which 3 of these committees stood out because of their functions. In no particular order, the first one, Health Professionals Registration Committee, which manages the compliance of the practitioner to registration guidelines while also protecting the public. It receives complaints regarding alleged impairment and initiates formal and informal investigations. The second one being Executive Committee, which initiates and oversees preliminary procedures and investigations before referring to the Disciplinary Committee. Last but not least, Disciplinary Committee. It considers and interprets professional misconduct, transgressions of the Code of Ethics and hears disciplinary cases. Bear in mind that Health Professions Council of Zambia handles all health practitioners except for nurses and midwives. HPCZ prides themselves of their integrity, innovation, service delivery, accountability, excellence, and fairness. If you need to get in touch with them, you can easily look up their contact details, their location, and their working hours. For detailed information, be sure to visit their website www.hpcz.org.zm. For a complaint against a nurse or a midwife, Part 3 coming soon.